Good afternoon, everyone, and thank you for joining us today. Today's webinar will provide information on Certificate 4 in Medical Practice Assisting Scholarships regarding workforce advantages with medical practice assistants. And thank you for your patience. Just took a couple of minutes to get us in here today. My name's Lisa and I'm an Education Officer from the Primary Health Network. And before we begin, I'd like to acknowledge the traditional custodians of the land in which we all live and work on, and I'd like to pay respects to elders past, present and emerging and extend that respect to any First Nations people with us today. Just a couple of things to mention before we start. This session today will be recorded, and throughout the presentation, if you do have any questions, please pop your questions in the chat box. At the end of the presentation, there'll be time for Q&A and I'll read through your questions. All registrants from this session will be emailed a link to the scholarship section of the PHN site where further information on this opportunity can be found. There'll also be a link that will be put into the chat as well that will take you to the same part of the website. So at the end of the session, I'll post a link to a short education evaluation, a QR code as well. So that will go in the chat and feel free to complete that. And we welcome your feedback for future education sessions. I'll now hand over to Alana and Kay from the UNE Partnerships team for more information on this opportunity. Thank you both for joining us today.
Thank you so much, Lisa, and good afternoon, everyone. My name is Alana and I'm the Partnership Manager here at UNE Partnerships, a nationally registered training organisation within the University of New England. Thank you for joining us today for today's Lunch and Learn session. We hope you're able to enjoy your lunch while we share some valuable insights about the Certificate 4 in Medical Practice Assisting, a qualification we are proud to offer in partnership with the Hunter New England and Central Coast PHN. In just a moment, you'll hear from Kay, our Health Training Manager at UNE Partnerships. Not only is she an exceptional leader in training and workforce development, but she brings a wealth of real-world healthcare experiences from her background as a registered nurse and a midwife to her work as a clinical facilitator and her experience delivering programs in schools and overseas in Indonesia. Before I hand over, I wanted to highlight that the Certificate 4 in Medical Practice Assisting currently has limited funding under Smart and Skilled funding. This means until funding places are allocated, the qualification, which is worth $7,990, is available for students with a contribution fee of just $500, thanks to the support of the PHN scholarship. As without this scholarship, students would be paying anywhere between $2,000 and $2,500. So this presents exceptional opportunity for anyone in your practice who has been considering this pathway with this opportunity through the scholarship. It's now my pleasure to hand over to Kay, who will take you through the details of the Certificate 4 in Medical Practice Assisting.
Thanks, Alana, and good afternoon, everyone. So, yes, we're here to talk today about the Certificate 4 Medical Practice Assisting qualification. Just to start with, as it states, this qualification is for medical practice assistants, or as they're commonly known and fondly known as MPAs. So we know that MPAs have a very much an increasing role to play within the practice, aiming to alleviate some of those stresses and workloads that are on medical practitioners and registered nurses. So HLT 47715 Certificate 4 Medical Practice Assisting is a nationally accredited course under the Australian Qualification Framework Level 4. It does reflect the role of the MPA, whose work includes a broad range of administrative functions, and also it's combined with other tasks to support medical practitioners, namely clinical tasks in the treatment room. These tasks are completed under the direct or indirect supervision of a medical practitioner. So, what is an MPA? An MPA is a member of your practice, a very welcomed team member who are formally trained in a number of different skills to be multi-skilled, to be flexible in practice, and as I mentioned before, really provide that administrative role as well as, some clinical assistance. An MPA can perform those tasks under the discretion of a registered health professional. So it's important to note also many MPAs fulfill a practice management function. They can help with human resource management, handling financial accounts, rostering, and office management. So one question that's often asked in regards to MPAs is what is their scope of practice? What is their role scope? So they need to perform their duties, their delegated clinical and administrative duties within the supervising health professional's own scope of practice. That's very important. They need to be consistent with national and state legislation. It has to be in accordance with the healthcare practices protocols, so policies and procedures, and also within their own scope of what education they've obtained, what their training's been, what their experience is. It's important to know that MPAs are not independent practitioners. They can't make decisions regarding the care of patients. They can't determine investigations to order. They can't diagnose. They don't refer or prescribe and do not provide counselling services to patients. So that's very important with their scope of practice. I would like to add there too that we talk about supervision, and supervision of MPAs, it should be active and continuous. So the next question there is, what does a student learn in this certificate for qualification? And how will they use that in practice? So first aid, they can and will provide first aid if required. They will work legally and ethically with a diverse range of people, support health professionals in the delivery of care, and communicate appropriately in the healthcare context and facilitate that coordinated approach to client care. Those main points there of what they learn and what they put into practice are based on the number of different units of competency that they learn and study in this qualification. So if we look firstly at administrative duties, I won't read all these out, but you can have a look there. They are fully trained in a wide range of administrative tasks that are required in that medical practice setting. So you'll see there may be some that, if there's already an administrative role going into this qualification, they might do some of these already. Some of these administrative duties are covered in other qualifications, for example, the Certificate 3, Business Medical Admin. And in addition to those administrative duties, as I've already mentioned, there's a number of clinical tasks also that they're able to complete. You'll see there's clinical measurements, and there's also a number of tasks that start with provide assistance. And that's really important to note that MPAs they're there in an assistive role. They are medical practice assistant. So not to be clouded by, an MPA can do, walk into a practice, do wound care, able to remove sutures. They are still tasks that the health professional are required to do, but an MPA can assist. So that would be, for example, setting up a sterile field ready for the removal of sutures or for any other procedures. Very important to note, it is an assistive role. So what is learned in Certificate 4 qualification continuing? There are 23 units of competency. This program actually employs a mixed delivery mode. So we have students that study online using our electronic course material and assessment tasks. That's in an online learning platform that they have access to. We have facilitator-led face-to-face workshops. So there's 2 workshops in this qualification. There's a clinical skills workshop and a first aid workshop. I'll talk about those a little bit more shortly. We also have opportunities for students to engage with our qualified educators. Generally speaking, we invite them to a virtual meeting via Zoom or Teams, where we can provide students with ongoing support. Students should commit to 15 hours per week of self-directed online learning, plus their on-the-job training. Okay, so workshops. As mentioned, we have two different types of workshops. We have our clinical skills workshop and our first aid workshops. So firstly, with the clinical skills workshops, these workshops do run over a few days where students are able to perform skills in a simulated environment. Those skills are such as clinical measurements, ECG, sterilisation, and supporting health professionals and confirming physical health status. So supporting health professionals a lot with their treatment room procedures, etc. We have a number of workshops, and I've put some up here on the screen just to demonstrate what's ahead. We do like our MPAs to complete their clinical skills workshop in the first 6 months of the program. This is important so they're able to have ample time to practice those skills and do quite a number of them before they actually are in the workforce as an MPA. So we have 2026 workshops. Some of these might be a bit early, but for example, we have one in Sydney in April. We have one in Newcastle in July and October, in Goulburn in August, and we'll be releasing the 2027 dates shortly. Now, the reason I've put other locations there also is to certainly let you know that should it come time to complete a clinical skills workshop and a certain location or date doesn't quite fit with the student, there are other options. And we do send out an expression of interest for the workshops. Once the student replies, identifying the workshop they'd like to go to, the registration is then confirmed. So obviously, they may be subject to change if we don't get enough registrations, but generally speaking, we do, and we would certainly make sure that communication is with all new students. The first aid workshops, they aim at a unit which is based on providing first aid, but also advanced first aid at this time, and that also includes CPR. Now, 2026 first aid workshops in New South Wales, we have those, in Sydney in July, Newcastle in October, and Goulburn in November. So really speaking, first aid is one of those units of competency we like to do right at the end of a qualification, purely so an MPA is starting their role with that qualification being nice and fresh. So those dates really for 2026 aren't the best dates for this upcoming cohort. We will be releasing 2027 dates shortly, but I imagine they'd be in similar months next year. It's really important to note for everyone that you also need to meet eligibility criteria to attend these workshops. So the eligibility criteria is based on completing units, showing that you're progressing through the qualification and the assessment tasks. We will be providing some more specific dates in some other information that we'll be sending through. I think it'll come from the PHN actually. Just as another note, I did want to mention also that there are pathways to other qualifications through doing and completing the certificate for medical practice assisting qual, and one of those pathways for a high qualification is into the Diploma of Leadership in Healthcare Practice, if that was of interest to the student. So if there's any questions, we'd love to hear them, and I think we're putting those into the chat, is that correct?
Yes, when they pop in the chat, I'll read through them for you and hand over to our presenters to answer them. And we've also got Cheyenne here, one of our senior project officers from the Primary Care Workforce and Access team at the PHN. So she may pop in and answer some questions as well for things that I don't know. So feel free to pop your questions in the chat, everyone, and we can address those questions for you. I think it was so informative. Kay and Alana, we might not have any questions today. Oh, there we go. The course is 2 years. Can we do it faster? Is the first question.
Yes, absolutely. So self-directed learning and the workplace learning is really, I guess, if you're going faster than 2 years, yes, it's at your own pace. We certainly have students that, quite frankly, zoom through their units of competency. They devote a lot of time into completing each unit of competency, and yeah, they come through with their qualification in record time.
Fantastic. The next question we've got is, where is the Newcastle training based, and is there accommodation on site?
Yes, we do send out details of that. Most of the time we have our Newcastle clinical workshop at I'm trying to think of the motel. Can you think of what it is, Alana?
It's the Holiday Inn.
Holiday Inn, that's right.
Yeah.
Holiday Inn.
Really nice rooms, and the training's downstairs in the function room.
Yes. Sorry, a lapse of memory there for a minute.
No, it's all good. I've got another question here. I have a receptionist that is nearly finished her MPA. Can we utilise her for preparation of care plans for GPs within her scope or skill set?
Yeah. So I think that was the key words there within her scope. So obviously, going back to the information I shared on scope, it really is in accordance with legislation and guidelines in respect to her qualification, what she's learned, what she's actually put into practice from her learnings, from what units of competency she's completed. If there's any question mark over any task that is set for an MPA, the practice really needs to think about the supervision there and whether that's actually acceptable within that practice. So from an RTO perspective, the units of competency that an MPA has been deemed competent in learning, then they're able to practice those skills. So if it's outside of that, then the practice needs to look at that themselves and actually really, I would say, make sure you seek some guidance, whether that actually falls within your MPA scope of practice. Unfortunately, I can't speak to each individual practice. I know that MPAs are tasked with other roles. I can speak to what we train our MPAs to do. And so anything outside of that really is practice by practice. And as I mentioned, I think it's just really important to note that it's under the supervising health professional scope of practice themselves. And potentially that MPA has had that training within the practice. There are tasks that they can complete if they've completed, credible training within the organisation itself, that you're consistent with national state legislation and consistent with healthcare practices protocols, in addition to what the MPA learns. I know for some that might sound a little bit vague, but hopefully that gives you a bit of guidance on where to look.
Great. Emery just said thank you for the answer to that question. Do we have any more questions? Feel free to put them in the chat. We've still got a solid 7 minutes, so definitely have time for any questions. Okay, I think we may have answered all of our questions for today. Is there anything further, Alana Kay, that you may want to add?
I was just going to add that we're looking at commencing on the week of the 13th of April. I know Cheyenne will have closed dates with the scholarships, but this new cohort coming through will be commencing week of 13th of April.
Fantastic. Just another question that's popped in there. How does this qualification compare with AHW?
The Aboriginal health worker qualification?
Yep, if they just want to clarify if that is the qualification there. Yes, there we go. Yes, that is confirmed. Yep.
Yes. So I do believe that there is there is a substantial alignment. I have actually compared the two qualifications before, and there is alignment. However, my understanding is that there's actually more scope with the Aboriginal healthcare worker in what they can actually practice.
Okay, great. The next question is, when would the cut-off date be for the Newcastle July date, if we have that information? Oh,
Sorry, I'm just jumping. Kay might have actually rose. It might be to do, so certain units have to be completed, that's right, Kay, is it before they can actually go into the first clinical workshop? So if they're starting in April, what are the chances of them starting in July? So that first clinical workshop.
Yes, so the main unit of competency that we want students to complete for their clinical skills workshop is an infection control unit, which is one of the first units. So, like I said, you know, if that's completed, if there's a demonstration that they're progressing through the qualifications, so actually, you know, meeting. So, sorry, let me just go back a minute. Students do receive a study schedule, which keeps them on track on, you know, how often they should be starting new units of competency and submitting assessments. So if a student is progressing through the qualification in accordance with that, then definitely they're meeting that eligibility. So yes, if you're keen and you can get in and get started and complete that unit of competency, in particular the infection control unit, then yes, we can certainly get you into that workshop.
Fantastic. Just one question there. What support is available weekly? I guess what is their support? If you've got questions.
Our health educators do have their own bookings links, and they do have appointments available at various times through the week. So that would be communication between the student and the educator on how often that connection needs to happen. But certainly if a student is requiring weekly support, then that can be organised.
Fantastic. There we go. Lots of thank yous of great answers to questions. If there's any more questions, guys, feel free to pop them in the chat. I will just post the link to the education Slido survey in there as well. There is a QR code. If anyone wants to complete that, that'd be fantastic. If there are any more questions, we've got 3 minutes left. I'll just wait a couple more seconds. If there's any more questions, feel free to pop them in the chat. We can give you 3 minutes back into your day. Right, I think that might be all. Anything further to add, Kay or Alana or Cheyenne?
Good for me, thank you.
No, wonderful. Thank you so much for that. So as I mentioned before, all registrants to this event will be sent a link to the PHN Scholarship site. That same link is actually in the chat there for those that may have missed it. Thank you for joining us today, and thank you again to Alana and Kay from UNE Partnerships for that fantastic information of the upcoming opportunity, and hope you enjoy your afternoon. Thank you all for your time today. Really appreciate it. Thank you.
Thank you.